I have people from Turkey, South Africa, some countries in Europe, Philippines, Pakistan.
Wow, that's very cool.
Yeah. Hi, Michelle. Now wait a couple more minutes. I don't know where you guys are. Well, I do know, but it's freezing here in New York today. Like freezing.
Chilly here in Ohio too.
Below zero temperature.
Ugh.
Yeah, chilly in Ohio as well.
Okay, I think we should start. Well, we'll have more people joining us as we go. So welcome everyone to another edition of Prevention Talks. My name is Maria Luna and I am the director of the Applied Prevention Science International Education Center. For our prevention talk today, we will be talking about substance use prevention in the workplace in the changing landscape of COVID-19. And in our distinguished panel today, we have Dr. Rebecca Hirsch and Anthony Coetzer-Liversage, also a PhD candidate. So Rebecca Hirsch, she is the Associate Director of Research Development, Integrity and Assurance at George Mason University in Fairfax, Virginia. Prior to Dr. Hirsch joining the staff at George Mason University, she was a Senior Research Scientist and Senior Vice President at ISA Associates in Alexandria, Virginia. She received her master's degree in clinical psychology from Clark University in Worcester, Massachusetts, and her PhD in applied social psychology with a concentration on health at the George Washington University in Washington, D.C. Dr. Hirsch has been conducting workplace-based health promotion and substance abuse prevention research and development for over 25 years. Welcome, Rebecca, and thank you for being here today.
Thank you so much. I'm going to try to go through this in some ways pretty quickly because of one, I want to get to questions, but also because I think we have a broad audience. I'm not quite sure who is in the room. I know it's international. Some of the data that I'll be presenting will be US-centric, but we've also tried to include international data. But I also want to know that, I'm going to be making the case for workplace prevention. And certainly it's true that among some of the people in the room, I might be preaching to the choir. So, so forgive me if you're following that camp. Oh, look, it works. Again, we're talking about providing workplace prevention in the changing landscape of COVID. We'll focus most of the talk on the scope of the problem, talk a little bit about some data, what is the data shown us, current data, some past data, and what are changes we're seeing amidst the COVID-19 pandemic. As I said, I'm going to talk about why workplace is an important setting for substance use prevention. Again, maybe speaking to the choir, but we do want to indicate why it is important. It's not always clear that the workplace is a place where you can do workplace prevention. What is the evidence for the efficacy as well as the return on investment for substance use prevention? And how do we address substance use prevention in a time of COVID, particularly in workplaces? Again, talk a little bit about what the research tells us about some of the most promising approaches. So I don't know if we have the poll, if that's going to be, so we have these myths and facts. So we've put these up here, and we wanted folks to say the extent to which they believe this is a myth or a fact. So again, Anthony, Maria, look, we have it. Super. So if you can take the poll, and given these statements, let us know whether you think it is a myth or a fact. And then Maria, when you're ready, or when you think it looks like it's nearly full, you can put up what people thought. Okay, do we have the results of those yet? I don't know.
Joe?
Yeah, I was giving him just a couple more seconds because
Okay.
not everyone's done.
No problem.
Oh,
All good.
I'm looking forward to seeing what everyone has to say on the poll.
Thank you.
That at least gives us a foundation of seeing where everyone's at and before we launch into this.
Do we have those yet?
I have some people missing, but I can end it if you'd like.
Yeah, I think we can. The people may not want to respond. That's certainly possible.
Sure.
Not everyone has to. Okay, so that's, I'm just looking at it and knowing what I'm going to be talking about. Okay, great, thank you. I'm going to close this down. And I'm going to get to, and I think folks did, reasonably well. I can't, for some reason my screen is not, there we go. sorry about that. So I think folks did reasonably well. Indeed, we know that the first one, substance users are primarily teenagers. We know that this is a myth. We'll talk about that in just a little bit. There are lots of workplaces that really do believe that substance use is a personal issue, but not a workplace issue. But it is absolutely a workplace issue. And we'll talk again about what it is about personal behavior that has direct impact on the workforce and on the workplace. We'll talk about then why the workplace is indeed a good place for substance use prevention. So the next one, the workplace-based prevention is a good investment for workplaces is a fact that we know that the return on investment for workplace prevention in terms of productivity, turnover, in some cases reputational, something that's hard to really quantify, as well as increase or decrease costs in things like healthcare utilization, workman's compensation claims, those kinds of things are primarily US centric, but those costs go down when you can reduce substance use among your workforce. Again, if you don't start using psychoactive substances as a young teenager, there's almost no chance that you'll begin using as an adult. And most of you said, I think that was a myth. We'll have a slide coming up that'll show the initiation of substance use among young adults is actually higher than you might think. And indeed, it was a fact. We had a little bit of some people thought this was a fact, some people thought it was a myth, but indeed, most adults who use drugs and alcohol are employed either full-time or part-time. Again, making the case for why the workplace is a place where prevention really needs to happen. So just some facts that we can provide you on the state of where we find ourselves now. The WHO estimates, the World Health Organization estimates substance use worldwide. We have 2.3 billion alcohol users, 1.1 billion smokers, 270 million who use drugs in the past year, and 35 million living with a substance use disorder. We know that a little over half of adult binge drinkers of the 56.6 million binge drinkers, 75% were employed. And that we know similarly that a significant number of heavy drinkers, but not binge drinkers, but almost the same amount were also employed. Again, looking at the data from the US, we know that in 2019, 13.4% of adults 18 years of age or older reported a past month use of an illicit drug, and a little over 21% reported past year use. We do know again that the vast majority of those folks are employed either full-time or part-time. Some data from South Africa showing, again, similar rates of employment among harmful drinkers and substance users. So this is a slide that I wanted to sort of point out where we think about the initiation of substance use. So what we're finding is that while indeed, we have teenagers, slightly older teenagers whose first use of a drug for PCP, marijuana, inhalants is in their teenage years. For other drugs, pain relievers, heroin, sedatives, tranquilizers, what we see are young adults. And again, these folks are in the workplace, very likely. And so it is not the case that folks are using as teenagers necessarily and giving it up. They may actually have their first use of a drug, either because they have new stressors, because they have newfound money, because they are interacting with folks that are different than folks they may have grown up with, that are giving them either access to or a mechanism for substance use.
If I'd like to just point out that we provide a lot of facts, figures, so some people battle to understand the data, but what we point to here is that really is that people's biases tend to assume that people are using any form of substances are either unemployed or on the streets. We have those images when we cap people who are using, that comes to mind, but what the data has been showing is people are employed, and that a lot of it is people that are entering the workplace. And that workplace is actually a major point for initiation of substances that we have to pay attention to. So that's just trying to help us set the stage of why this is so important for us to pay attention to. Thank you.
So, yep, absolutely. And I'm going to have Anthony will come in throughout this presentation to provide additional context. Some of this information is data, but part of that is because we don't have ongoing really solid data, because this is an area of research that continues to need more research. But we do know that there are significant costs around substance use that impact the workplace. And again, these are primarily from the US, because that's where we had some of this information. But these costs are in the, $1 to $200 billion, and they are in things like lost productivity, healthcare costs, which in the U.S. is you have private insurance that is in some cases often provided by or supplemented by your workplace, and so to the extent that those costs go up, those are increasing costs. There's also crime, property destruction. There are societal kind of welfare costs as well for folks that are substance use and are trying to get access to substances, for example, through criminal activity. Again, similar things for drug use as it was for alcohol. And then we also know that we have similar data, not just from the US, but from international data. Again, some of this data is older, but we do know that there are data from the UK showing excessive alcohol use in terms of the lost work days, lost productivity, as we think about in the workplace. Accidents in the workplace, so an increase in substance use related accidents, and that the death worldwide around alcohol use is significant. And we talk about this because we're going to talk a little bit later about the cost of replacing individuals who leave your workplace because of a substance use disorder or death or disability caused by a substance use disorder. And those are real costs to employers. Again, we also know that the impact of substance use on workplaces specifically. So we know that employees who are substance using employees are 3 times more likely to be involved in a workplace accident. They're more likely to report working for 3 or more employers in the past year. Some of that is related to their own work behavior, and so they can't stay at an organization, or they may be fired from an organization. When we were looking in things like drug testing, for example, there are employees that choose where they work because of a lack of a drug testing, for example. So if I know I'm a substance user, I'm not likely to want to work for an organization that does random or for-cause drug testing. And so I may be shopping for places to work, particularly in certain industries like construction, transportation. Employees that use substances are 2.5 times more likely to have 8 or more days absent from work. We'll talk about this. Absenteeism and presenteeism, that is being at work but not really being at work, are real costs to employers. Their behavior make them 3 times more likely to be late for work. And this is the sort of the last 2 are replacing workers is a real cost to employers. So you may have a substance using employee, and the easiest thing to do would be to let them go, to fire them, to not have them return to work. But that cost is real. It is 25 to 200% of the worker's salary and compensation to replace that worker, to go out and find the employee, to train them up to where the other employee was. And so there is a benefit to both providing prevention so that employees don't have to be in that situation necessarily in the first place, but also to provide early intervention, treatment as needed, and a mechanism by which they can return to work in a way that is supportive of them and cost effective for the workplace. So simply firing employees with substance use disorders or who have engaged in substance use behavior and whose work is erratic is not really the answer. So how do these costs or these substance use problematic behaviors translate into real costs? And we've talked a little bit about this. I'm not going to go over this, but if you have impact on your health, you're going to have increased medical costs. It can have a negative effect on worker relations and morale, so that if I as a substance using employee, not really doing my work or exhibit behaviors at the workplace that seem erratic, my coworkers have to make up for that sometimes. And so that reduces morale, productivity, the quality. It certainly I can exhibit inappropriate behaviors, which impacts management and the time and the costs for disciplinary procedures and thinking through that process. There are certainly job losses and high staff turnover in workplaces that aren't prepared with a drug-free workplace prevention policy and procedures that can be supportive of their employees. And so it isn't helpful to a workplace to have lots of turnover in their employee population. So again, I won't go over all of these, and we can make these slides available, but those are some of the impacts of this is the behavior, and this is the real cost to an employer.
If I could just give a bit of context to why we actually provide that, is having done prevention in the workplace and knowing others that have done it, is a lot of the times we have difficulty. Workplaces won't let us in the door. They say that it's not relevant. And so what you have to do is turn the story on to them. They were interested in their bottom line, and it's all about money and their return on investment. When they hear these costs and these direct or indirect, it's when they start to actually pay attention, go, hold on, I can actually get more money out and I can reduce my costs if I actually engage with paying for prevention. So this is why we start pointing to where these argument points that we can use as prevention professionals to get us in the door.
Right, we talk about making the business case for prevention, because it's real. You're making a business case for prevention. And there's certainly employers that want to contribute to their communities and have a real, socially engaged workplaces, absolutely. But at the end of the day, it's also a business case. It has to make sense for employers. And it does, if you give them the data and the evidence that it does. We really wanted to talk a little bit about where we're seeing now in COVID, and why COVID has impacted so dramatically what we're seeing. We do know that the COVID pandemic has increased dramatically stress. And what we mean, and that translates into fear and worry, your health, the health of your family, the health of your coworkers and friends. An enormous impact on finances and on work. There are just millions of people who have lost their jobs. And in losing their jobs, they're losing some of their support services. But we've also found that when communities shut down, that some of those community-based support services were also shut down. And so again, this has had a dramatic impact on substance use behaviors and substance use prevention and early intervention. Some of the other impacts of stress, of course, are changes in sleep and eating patterns, difficulty in concentration. We know that there's a worsening of chronic health problems, both because of the impact of COVID-19, but also because people with chronic health conditions were not and continue not to seek health care because of the fear of contracting the illness. And so they are not getting help for chronic health conditions that they might have ordinarily, not seeing their doctors, not engaging in some of the behaviors that mitigated those chronic health conditions. We absolutely know there's been increases in depression, anxiety, and behavioral health issues related to COVID. And we have absolutely seen an increase in substance use. So some of the problem is that the interventions that have, most of the shutdowns that we talk about, the fact that I am teleworking, we'll get to that in a minute. So these interventions that are addressing the spread of COVID have or may have caused physical and social isolation. They absolutely have. People are not interacting. They're not having the touch points that they've had before, either in their workplaces or even in their social life. There's a closure of schools and businesses. We've talked about the widespread job losses, but the closure of schools means that people who do have jobs are also balancing that working full-time or trying to, whether in person or teleworking, and the fact that their children are at home and learning. And how do you balance that? And how can you be at a workplace if you also have to be at home because your child is not in school? How do you manage, even if you're teleworking from home, to also homeschool or with their schooling your child? We know that the impact of COVID has caused an increase in substance use, as I said, and increases in domestic violence. And this is also problematic because we know that there's been increases in domestic violence. We also know there's decreases in the report of domestic violence. And that's partially because those places where that would be obviously seen, a workplace, a school, other places where we interact with people, those interactions are not taking place. So the people that would see or report or help you report a domestic violence incident are not happening. Again, more isolation because of COVID-19.
And it's not just isolation. I mean, as a prevention professional, start seeing that although a person's isolating and we're not able to actually start doing our work and getting our touch points to touch on the various things where we would be doing prevention, that has been failing for us to be able to reach people.
Exactly. So how does the workplace impact the worker's substance use, and what might be the impact of COVID and all of this as well? So we do know that people with substance use disorders are more susceptible actually to COVID-19 and its complications. So there's sort of the reverse of that. And that's because, again, compromised immune systems, other impacts on your health that makes you more susceptible to substance use disorder, to COVID if you have a substance use disorder. There's been an absolute enormous increase in opioid overdoses in states that in the 30 states that reported that the spikes in fatal opioid use disorders. Again, a number of reasons for that. People using opioids to combat stress in a variety of ways, as they have always to use substances, and so this has just been exacerbated. Those places where people might be able to get treatment, might be able to get services, also closed down. And so we saw a spike in treatments. I happen to be working in a program in which works with justice-involved individuals. And so as the COVID-19 pandemic increased, there were a lot of jails and prisons that released their population, released people into the community because of overcrowding, because they were seeing rampant COVID in those facilities. Those people were released to the community without linkages to services. Many of them received their opioid use disorder treatment in the correctional facility where they may have been, and then when they were released didn't have a place to go and didn't have those linkages to services. And so we saw a spike in opioid use at that point as well. We have seen an increase in treatment services, the need for treatment services. And so part of this underscores the need to remove the barriers to evidence-based treatment and support that we have seen. So I'm going to talk a little bit about the workplace and personal characteristics. So we know that there was an American researcher, Michael Frohn, who expanded on Kurt Lewin's sort of very classic that all behavior is a function of the person and their environment. And so if we think of the workplace as their environment, we'll talk about how those characteristics interact. It's represented in this framework as, so personal characteristics and vulnerabilities, and those are the characteristics that are risk factors. That is, what are the personal characteristics that lead to an increase in substance use. These can be personal characteristics like a family history of substance use, the lack of resilience, poor stress management, coping skills. Those are things that are in the individual. And then there are things in the workplace, and we'll talk about those. So what are the protective factors that are in a workplace, or the risk factors? We all know many workplaces where the sort of standard operating procedure is we work hard, we play hard. And so the culture of that workplace is one that we do our work, but then we go out and we drink heavily or we party together. And so there's that aspect of it. There are workplaces that there is access to substances in a way that you may not have had if you didn't work in that workplace. These can be places that sell, manufacture, hospitals, other ways in which there's diversion of medications that can then be used for substances, for people to take in terms of substance use disorders. There's also protective factors. Again, a culture of support, of resilience, of looking at the environment. Is there stressful work? Is there an increase in productivity that happens to be that is the norm in that, and people work 10, 12, 14, 16 hours a day? That impacts their ability and their whether or not they need substances to simply be at their work. So this is the model we talk about. So there are, again, personal characteristics that interact with workplace characteristics. You can have multiple personal characteristics that impact you. So I can have lots of risk factors. Like any disease, think about any chronic illness. You have risk factors for that disease. Substance use disorder is no different. There are multiple personal risk factors that increase the possibility that you may have a substance use disorder at some point. it's not an automatic, and there are other things that interact with those personal risk factors that mitigate that lower those. And then there are also multiple workplace characteristics. So you can have a poor physical plant, no light, not real good circulation, lots of manual work, my own lack of control over your work environment, or control over the work that you do. It can be a very high pressure job. It can be a job in which there is no health and wellness support for you. So these are all different kinds of workplace characteristics that also, if there's a lot of them, is a very unhealthy or very unhealthful place to work. That said, because there's all these interactions, there is, not everyone that is in an incredibly unhealthful workplace situation will use substances. And those people that are in wonderful workplace situations may also use substances. So both of those are true. It is an interaction. And so we look at these different interactions. I'll talk just briefly here also about the difference between workforce and workplace. So workplace substance use is substance use that occurs, as it states, in the workplace, at work, on the job. We'll talk about how that impacts when you're working from home, and the very blurred what is a workplace that we're now finding ourselves in. But that is workplace prevention, actually drinking or using substances while at your place of work. Workforce is what I think many people think about, which is I use substances but not at work, but maybe just before coming to work. And so the impact of that substance use has a direct impact on how I behave at work because I've just used that substance. Again, we've talked a little bit about this already, looking at the top of this chart. Again, looking at the different interactions of workplace substance use, of workplaces and its interaction on personal characteristics for substance use behavior. I want to be mindful of the time, so I'm going to go quickly through this, but that we've talked a little bit about how those interplay. So the question is, how does COVID impact this relationship? Well, I mean, probably the most enormous disruption has been that many people, if you were fortunate enough to have a job, you ended up having to telework. And so that disrupts any protective factors you may have had. The people, the touch points, the resources, an employee assistance program, a wellness program, clinic on site, whatever it might be, you no longer have access to those protective factors. We're also grappling with what is work time? So it's pretty fluid when you're teleworking. Am I at work? Am I at home handling a child or other personal issue? What can I decide to have a beer at lunch because I'm not really at my workplace, I'm at my home, and I think that's okay. That's, that simply wouldn't have happened if you went to a workplace. And, or at 3 o'clock, I'm going to have a glass of wine, even though that might still be work hours. It's very fluid. There's a lot that because COVID has disrupted our workplaces, has also changed how we behave and may have increased substance use. But it's also true that I think workplaces are not sure how to grapple with this. How are you defining what is work time? How do I know when you're at work? How can I manage and monitor that? It's been an enormous, I think, problem for workplaces as well. We do know that folks that have lost their jobs, to the extent that there was something like a counseling program or employee assistance program, have lost access to that. And that can be an enormous problem for those that really access those, and it would have been the way of first seeing a substance use problem and intervening really early. There have been fundamental changes in how staff, employees, colleagues interact with each other. We're doing this by Zoom. We don't see each other. We are also, if you are physically at your work, you are masked. It's a very different way, or you're isolated, or your doors are closed, or you're behind. In my workplaces, there's lots of plexiglass. If I had, in where my office is. And as I said, how they spend their working hours and how those blend with personal time. And so there's just been challenges to work-life balance more so than I think we've ever seen before.
Yeah, so I've just pointed out that, as we've seen earlier, is that COVID itself elevates the stress, and now you start seeing the breakdown in those connections and things start happening, we're elevating stress even further. And we know with anyone who tends towards coping and break down their coping, substance is a wonderful way to do it. So now we start seeing where people with mental health challenges could be made worse in situations, as well as those with substances. So we start seeing a whole breakdown that drives people towards that higher stress and need for substance coming in.
As I've often said, it's the use of substances, the use of alcohol and other drugs to reduce stress works, sadly, in the very short term. If it did, if it didn't, nobody would use it. It's in the, that's both true and very unfortunate, because in the long term, of course, it doesn't. It exacerbates all of that. But for that moment when you're feeling that intense stress, you take something and you suddenly don't feel that stress. And when you're home alone, you have more access to being able to do that. Just a couple other things. So we are seeing reopenings. We are seeing people doing more in-person work, or a requirement that you come back to work, or people that never were allowed to leave work. And that is also exacerbating. While they can be exciting, I'm really looking forward to seeing my colleagues again. There's a lot of fear and anxiety around that, well, what does that mean? How can I still be safe? Employers also, for example, that have drug testing need to reconcile and balance COVID protocols, which may call for more isolation, less going out, and then sending them to a drug testing site. And so there's been some relaxation of drug testing, I think, in sites that had that. And again, we've talked about this. They're simply not the same touch points. Managers are not seeing their employees. Coworkers are not seeing their employees. And so the ways that we connected with each other, checked on each other, we simply don't have anymore. And so again, those impacts are real. I just want to put this on here because this is what the UNODC, the UN Office of Drug Control, really talks about. What do we mean by evidence-based prevention for the workplace? So we mean interventions that are non-punitive, and that substance use prevention is for everyone, for all stakeholders, not just for certain employees, not just for those who we think might be more at high risk. It is for everyone, and everyone needs to be part of the policies that are developed. Managers, employees, other stakeholders, if there's boards of directors, they could be involved too, but it is designed as a universal. So it's a policy on wellness and health, the way you might for any safety issue. There are brief interventions, counseling, referral to treatment, and a reintegration in a workplace are all part of the prevention wheel. So we do want prevention. How do you stop a behavior from ever happening? A brief intervention for engagement in substance use, for example, but that can be ameliorated quickly. For those that have substance use disorder that need a referral to treatment, having those treatment services available, and then a reintegration into the workplace. All of that is needed because, again, simply firing employees is not in the workplace's best interest. We know that embedding substance use prevention into existing wellness programs is a strategy that works. It's also a much better selling point. I will tell you, when we used to talk about substance use prevention programs, we had two kinds of people in the room. We had those in recovery and empty rooms. Those are the two rooms we had. When we started to talk about substance use in the context of stress management, I think we can now talk about it in the context of COVID in a way that we might not have before. We could talk about stress management. We could talk about substance use prevention for your family and for your children in a way that allowed people to look at their own behaviors and made it appropriate for a workplace and reduce stigma. I would like to have stigma not be an issue, that substance use is much like diabetes. We can talk about it, but that I know is not real yet. And so we have to figure out what are the ways to get to talk about substance use behaviors, and they're in the context of health and wellness. We include training for managers, employees, health and wellness. There's clear guidance, clear guidelines on communication. The policies are understood. Everyone gets a copy of it, or they're posted. They are for everyone, not just for certain people. And there is a guarantee of confidentiality if someone comes forward and says, I believe I may have a substance use problem. How can I get help? And so that is treated with confidentiality. It is not then reported somewhere else. And again, drug testing in and of itself, alcohol or drug testing, is not a prevention program. It could be a part of a prevention program and part of a total drug-free workplace, but it is not in and of itself a prevention program.
Yeah. So what we're seeing is, if you're going to do workplace prevention, these are components to try and move your programs towards an evidence-based program. And what, as prevention professionals, we can recommend are components to actually start building on and collaborating to develop.
Some of these include, so we talk about workplace prevention absolutely should include the sort of universal for everybody, a workplace policy, a drug-free workplace policy, wellness and substance use prevention education, so wellness programs, resilience. You can strengthen peer support and peer referral to counseling as needed, if that is something that can be done in a workplace, in your workplaces. That is another kind of more universal prevention strategy. For those in which there is some indication that there is a problem, and that's typically simply by workplace behavior or performance. We don't know what that problem is, but we know there's some kind of performance problem, that a confidential screening for substance use as the cause of that problem may not be, but it could be. And so some initial screening for that. Employee assistance programs are a big part of that. And brief interventions, brief counseling can address a problem very early on. And then if needed, if there's substance use disorder and substance use has risen to the level where treatment is really what's indicated there, is that referral to treatment, both outpatient and inpatient treatment programs, and as I say, a return to work and relapse prevention. Substance use disorder, like other chronic illnesses, can be a chronic relapsing condition. And so we need relapse prevention, and we need mechanisms to reintegrate someone into the workplace, but potentially reintegrate them in the workplace that may require some accommodations. Again, accommodations not unlike other conditions that require accommodations in the workplace. Reason to believe in this personal workplace interaction, that something about that workplace or their previous work situation may have exacerbated a personal vulnerability. And so if you can determine that, there may be accommodations that can be used, different kind of work or other accommodation that allows them to be successful, but return to work. And again, as we said, confidential follow-up care. The targets of these, the workforce environment, is the written policies, targeting to address the quality of the work life. Can look at those. The supervisor and management training, how do managers interact with employees? If they're noticing a performance or behavior problem, they may suspect substance use, but again, that's not their job. Their job is to identify a work performance problem, and then providing the entree into counseling or another screening that would allow those people who are trained to provide that, to get that intervention. Again, targeting the entire community, entire company, not just selected people, and to really try to begin to change organizational culture. Talked a little bit about peer programs. That is, there are these peer support networks. Again, I can go to a colleague if I want to have a confidential conversation about some problems that I'm experiencing. Again, there's training programs and development of those peer support programs. And then there are social control policies that I don't use alcohol at work because I know my colleagues that's not our culture. Changing the work hard, play hard. That if my behavior in poor performance impact my colleagues' work, that's meaningful and a problem. And so I may not use because I don't want to impact my colleagues. And so when you begin to change norms around alcohol use in particular, but certainly other drug use as well. And just talk a little bit about just those that target the individual, because I really I want to get away from this as an individual problem. We only provide, the target of our prevention is always the individual. They need to change their behavior. So I've said, I think we can change the workplace, and that will help individuals to reduce their substance use and interact with their own personal characteristics. But there are interventions that do target the individuals. Employee assistance programs, while important for the entire organization, really provides counseling to that individual. We do want to address substance use as a health and safety issue, the way we do any other health and safety issue in the workplace. If you have general wellness, stress management, yoga, meditation, other kinds of programs, you can talk about substance use in the context of those programs. Exercise, we know that alcohol and other substances are actually harmful when you think about your own exercise or nutrition program. So you can talk about those interactions and again, begin to talk about substance use in a very different light. Talked about confidential screening, re-entry into the workforce, and then drug testing, again, only as part of a comprehensive program. This really just talks about these same things in the context of COVID. And so if you're going to create a workforce environment that is safe, we've talked about some of the things that are needed in the time of COVID. Talked about the fact that the way I talked about substance use prevention in the context of stress management, I think you can talk about this in the context of COVID. Use this as another entree into, well, what do we know about substance use and COVID? We know that COVID may exacerbate or increase substance use. We also know that substance users are more susceptible to COVID. So we begin to talk about, again, substance use in a way that we might not have before. Again, some of these are similar to what we've talked about before, and including things like yoga, meditation, which would both address the stress around COVID, but again, you can also add the issue of substance use and how that impacts your health and your wellness. If we're doing telework, I think it's important that employers begin to establish kind of an employee weekly check-in or another mechanism by which people are connecting if they are not already. I think it's important when people have lost that. Yeah, we've talked about this. Again, I think making employee assistance programs and telehealth. One of the amazing things about COVID is the opportunity that it has actually allowed. So that in the past, telehealth, telecounseling, substance use treatment, we were told you can't possibly do that by telehealth, can't use that, can't do that remotely, has to be in person, which was really problematic, particularly in our rural communities or other places where, the closest place to get services could be 4 hours away. Suddenly, in a matter of weeks, all health, for at least a while, became telehealth. And suddenly we could do that. I don't think we're going to go back. I do think that this is here to stay, at least I hope it is. We continue to have, addressing substance use as a health and safety issue, talking about stress management, and again, the confidential screening for the individual. So there are some tools that we can use now. I mean, there are evidence-based workplace substance abuse prevention programs. Most of those have been in person. So what do we know about, how can we do those, in the time of COVID? So there are a basket of tools that have been shown to be evidence-based. There's, and we have some of the citations here as well, but there are automated digital brief prevention interventions, again, targeting adolescents and young adults. And we do know that young adults is where we're seeing at least the initial problem in terms of initiation of substance use. Again, not exclusively young adults by any means. There have been web-based interventions addressing alcohol use, brief interventions in the workplace. I have colleagues that have worked on that as well. There are online wellness programs to talk about wellness more generally and substance use in particular. But again, these things that you can initiate online. The unique thing, if you have telework situations that we have found, is people in some ways are more likely to just log on from wherever computer they are than, for example, show up in to an in-person event. So we're actually seeing in some ways more participation when we moved some of these things online than we might have if we had to have them, either because workplaces are dispersed, so people are working at different places and you can only have an in-person in one place, or simply because it is easier for people to simply log on. There's a bit of anonymity in that as well. If you don't have your name or you don't have your camera on, you can participate with a bit more anonymity. So
And I think what's important here by pointing out that online has been a movement of prevention. Prevention's always been assumed to be face-to-face, and we do media campaigns online, etc. But we have been seeing the move that we can do it. Yes, treatment there has been a move towards it, but not in prevention. And we're starting to see, hold on, with COVID, we've had to pay attention that this is an avenue for us as prevention professionals.
And again, I think a trend that we will see continue. So I just want to, and I know I do want to get to some questions. So the changes in the workplace. We moved from, in 3 weeks to, from 31% of people teleworking or working from home to more than doubling that. And that those that were working remotely if they could work. What we're also seeing, and I know this anecdotally, but I think we're seeing this if you think of the real estate market in places like New York City, there are workplaces that have decided, we do this pretty well. We do this whole remote thing pretty well. I'm not sure we need to pay for a brick and mortar, a workplace, a set of offices in the same way that we did. So I think that when we get back, perhaps by the summer of 2021, into what may look like a more normal, that it will not look like it did a year ago in the summer of 2019, for example. I don't think we will go back to the same number of people working in person in workplaces necessarily. So there'll be a hybrid style of work. And how do we adapt to that? How do we adapt to that workplace? How do we keep our employees safe and well? And how do we address substance use in this kind of hybrid model? We don't know, as Anthony said, there's been an increase in e-learning, and I think prevention is also going to move to that. We also need to help our employees. I think many of us started working from home if we were working from home, and we had all kinds of work situations. Well, if people are going to now do this really more permanently, to create a workspace that looks like a workspace to the extent possible that you might have in your workplace. And so there's the Occupational Safety and Health Administration, OSHA in the US, which talks about a safe workspace. It's a little more complicated when that workspace is home, but how do we help folks create a workspace that is safe and healthy and if they're that even ergonomically less stressful than it might be if they were in their own offices.
And this is important because generally when we're dealing with workplace prevention for substance use, we are targeting the issues around health and safety in the workplace. So this becomes something that we have to think about and talk about when we're dealing with this new change.
So the opportunities, we've talked about some of them already. COVID provides another way to talk about substance use prevention in the workplace and other settings. You can do the sort of obvious, well, if masks equals a decrease in COVID risk, in the same way that, for example, lower risk drinking and following lower risk drinking guidelines reduces your risk for alcohol use disorder. You can make those comparisons. You can also talk about COVID is increased stress. That increased stress has led people to try to address that stress using alcohol and other drugs. Let's talk about that and how we can prevent that. Again, it provides the opportunity to talk about COVID and the stress it causes and substance use. During this time when employers are trying to figure out, well, what is work going to look like when we return to something that looks a bit more normal? You can take that time to really look at their drug-free workplace policies or their prevention plans to say, okay, when I bring my employees back or when we have this new normal work situation, what's currently in our prevention plan and how do we need to adapt that? Or if we've never had one, how do we need to address this now and how do we need to address the new workforce? It gives us the opportunity, and workplaces the opportunity to do that. And telehealth provides the key mechanism for providing substance use assessment and treatment services, and as Anthony pointed out, prevention in a way that we thought was impossible before, or people said was impossible. We now know it is not, and we need to capitalize on that and not go back to just business as usual as it was, because I think there's an opportunity here. So that was a lot, and we have like 5 minutes, but I can also stay over for questions. And Anthony, I think you're monitoring the chat.
Yeah. So everyone, please, if you're interested in terms of asking questions, we'll stay on longer just to try. It's taken us longer than we had planned. So if you've got any questions, let us know, write them or share, raise your hand so that we can get Rebecca or myself to assist in answering anything that you may have.
I apologize. You practice it, it's 20 minutes, and then you do it, it's 35, 45 minutes.
Okay.
I can also ask folks, again, have they experienced in their own workplaces? What things have they experienced around these issues?
No hands and no comments or questions yet.
Hi, this is Celie. Thank you very much, Rebecca. That was very, very comprehensive. And I think that it's good we spent more time on this issue because a lot of people are not aware of evidence-based prevention in the workplace or even of the workplace as a place for prevention. So I think this was very comprehensive. One of the things I wanted to ask you was, where do you see research in this area going in the future?
Yeah, it's a great question. So thank you, Zilly. I mean, some of the reason why our data is old is because this is not an area that's funded a lot. So I think we need to think about ways, I think, and again, I think COVID provides that opportunity. We know that the workplace is going to change. And so obviously a lot of the COVID research has been on spread, infection, impact. But now that we can take a breath, perhaps, we can look at more long-term. How does it impact the workplace? What does it mean for health and safety in the workplace? And what does it mean for substance use? And so I would encourage colleagues that are interested in work in this area to think through their workplaces, to say, to suggest funding in the area of either the implementation of a new prevention intervention, or a prevention intervention that takes health and wellness and looking at it in the context of COVID, or looking at how workplaces change, how that impacts a whole variety of health and wellness issues, including stress in the workplace, and then what things we can do for mitigating. And again, I think workplaces will not look like they did. And so how do you address some hybrid of work, and what impact does that have on substance use? I think that would be an area of research, because I think the tail of COVID will be long. And I think there are research opportunities around that.
Rebecca, I have a question. You were talking about when moving from the actual workplace to working from home and having to do that balancing act between children and work and everything else. Because I bet a lot of, yeah. How do you think the workplace can also provide those skills or bridge a little bit that balance that people need to find? Because sometimes, of course, I mean, there's companies, the large companies sometimes have like daycare passes when a child doesn't have school or whatever, but that doesn't exist anymore. So those backups that were provided by the workplace that were very good for the families that are not there anymore, but there's a new challenge. So what do you think can be done by workplaces at this point to address bigger challenges?
No, I think it's an excellent question, and I don't have an easy answer. I do think that there are, I think, things that, I'm going to preface this by, I think every parent that's working full time and has children at home is a hero. I was going to say that because I don't have that, and I've watched my colleagues do that. So one of the things that I've seen workplaces do is, is flexibility. So defining, we've talked about this, what is work? What are your work hours? And adjusting those as makes sense, so that if children are online school and getting them situated between 7:30 and 9 is really, they need a parent attention, for example, that you may work earlier than that or later than that. And so there's some flexibility around workplaces. I think workplaces, again, and this is hard because workplaces have suffered, many of them, dramatic economic losses. So asking them to do one more thing can be hard. But as we come back, and particularly if we remain in some hybrid, providing programs online, whether or not that's, and this doesn't necessarily cost necessarily a lot, but yoga, meditation, stress management, and health promotion, those things can be provided to employees either as they can log in. My new favorite phrase is synchronously or asynchronously, so they can have a series of things that they can log in when they're able, or a moment that they provide that more interactive. So I think that they can provide. I am going to ask one person to mute. I don't know if you can mute that person, Shelley.
Elvis Zambrano.
Yeah.
Yeah.
So that's so providing more programs, resilience mechanisms for employees. I think if you can provide specific times where employees check in with other employees or their managers to assess what they're, we've talked about this in some other ways, a check-in, how are you doing, what's happening, do we need to reassess, and so you just don't feel like you're flailing, I think is important. But I think we're going to be navigating around this for a while because we don't know what coming back to work is going to look like. You're right about the daycare. That was something that could be offered, but can't be offered if we're not doing daycare, or that people can't take advantage of, because if you are someone who, even if your workplace is coming back online or coming back in person, you personally may not be able to, because again, either from your personal health risk or a member of your family that you live with, you're not able to take advantage, and so you need to do that.
And it's really interesting because, just one quick thing, because it changes also the whole dynamic, where if you really, as a workplace, if you really want to be there and provide that support to your employees, then you also have to change from being sitting there from 9 to 5 to working with results.
Right.
So just focusing on what your people are delivering, not how many hours they're sitting in front of the computer.
I think that's absolutely right. I think it is a results based. It is a productivity, and we've talked about this, about whether or not do people need to come back to. I work on a campus. Might not need to, and we're all focused on you getting the work done. Are we providing you the systems you need? And that's something that may just be equipment. Do you need different equipment? Do you need different work situation? And can I provide that to you so that your work at home looks just like your work at a office, so that you can be as productive? But if I'm really great from 5 to 7 in the morning, and I take 3 hours to do something else because that's when my family might need me, and I may be able to come back online, but everything I've needed to get done needs to get done, then I do think there has to be some flexibility. And I think workplaces are seeing that. The bigger problem is those places that you need to be on. Susan.
Yeah. I think one of the things, Rebecca, that strikes me as you went over all of that is the real role of work, though, for people. That from a preventive point of view, being able to strengthen that work is very important for people, and it gives them a sense of worth, a sense of comfort. And of course, in these very uncertain times, all of that goes kerflooey, but reinstating that, and perhaps what Maria was saying, and as you start, and you were saying, bringing that back to the fore, that's a real prevention intervention of recognizing the value of work. And as we go into hybrids, or as address all as much as we can, that's also a preventive intervention is to bring that back to the fore and support it. And again, as you said, the environment, making your work and your environment work for you and make it more positive. So
right. Yeah, if work for people, it can be, and for many people, is a protective factor. Is a thing that that gives them purpose, that gives them structure, that gives them camaraderie, that gives them certainly income, in ways that interact with what might be a personal vulnerability to mitigate the possibility of substance use. And so without that, people have engaged in more substance use to deal with stress, and they have less social and personal connection on a daily basis with the people that they could have talked to, checked in with, or who are noticing, you seem tired today. I noticed you were late the last 2 days. Can check in on that and intervene early. That has been an enormous problem as people have become more physically and socially isolated.
And I was just going to make the comment of, well, how is all of this potentially relevant with, as a prevention professionals, with understand that the workplace might say, well, we've had this crisis, which is COVID. We'll eventually go back to more of a normal compared to what we've been saying, could be one argument. Yet what we can look at in workplaces preparing is that the research and everything from previous crises and disasters have pointed to the similar repetition of patterns. So as prevention professionals, we can actually then argue and support, well, what we saw going to happen during COVID and what's coming out of it, we could see these patterns before. And we can support workplaces in preventing and being ahead of things before they get worse, and we have an actual worse outcome for the workplace, so that they have less bleeding of their money when we face these problems. So that's the role of us as prevention professionals, to actually intercede and make people aware, hold on, preparation is key to all of this.
Right, I couldn't agree more. I think when we were talking about this, we looked at the crisis following in the U.S. and other places of the attacks of 9/11, of other fires or enormous natural disasters that occurred that wiped out communities for some extended period of time, and how did they rebuild and what did they learn? We should, and I hope we will, take what we've learned from those and what we learned from this. This will not be our last crisis. And so what do we know as workplaces to build resilient workplaces and resilient workforce? And what systems can we put in place so that we can do that in preparation for whatever the next thing is? And it's hard to know what that will be. But I think you're absolutely right.
Okay. Well, I think that's it. No one else has raised their hands or had any comments. I've put one last check in to see, but I don't see any response.
People should feel free to email us if you have questions. I think there was a lot of material to digest. People, in reflection, could share, particularly from other countries, because a lot of the research is very US based. That would be very helpful for us, and to share that information. And the recording is going to be on the website?
Yes.
Okay, so if you want to review this material, because as I said, I felt it was, Rebecca did a fantastic job of summarizing this really major issue. But I think that they can review it at their own pace, and certainly if they have any questions, we'll be happy to answer them and have Rebecca get involved in this. And we are recorded this, right? I just said that, right?
Yeah.
How much just from, okay. Sorry.
Okay, thank you everyone for being here today. I just want to thank Rebecca and Anthony for your presentation, Anthony for your comments, and bringing this to a very round conversation. And also to invite you for our next prevention talk. It's going to be on December 9th, and it will be on family skills and COVID, also connecting a little bit with what we were talking here in the workplace and all the the added stresses that families are having right now, and how can we, from the prevention side, do something about that. So,
and what's the date again? I'm sorry, Maria.
it's December 9.
I thought it was the 10th.
That was the 10th.
No, when we changed, it was
December
but we
10th.
changed.
Okay.
No. It's December 9. Wednesday, December 9.
Okay, great.
So, and we're going to put it in the website soon, so you can RSVP and enroll. So, thank you, everyone, and happy to have you. Thank you very much.
Stay safe, be well.
Stay safe, everyone. Keep
And
well.
thank you, Wendy, for your comment from Kenya.
No. And thank you, everyone, for being here. It's been such an honor to be able to help Rebecca put this together and have you all present to be able to share. And we look forward to having you at our next talk. And thank you, Rebecca, and everyone else on the team and panel, as well as everyone in attendance. Thank you all. Take care.